Hello, my name is Brian Wilson from Catalyst Physical Therapy and Wellness. Today I'll be taking you through a routine for your lower back. This is for people that have chronic lower back pain or just kind of in general get soreness throughout the day as they do things, and notice that it tends to migrate and generally stay right here in this lower back. What we're going to learn today is just a way to wake up and begin to kind of get the spine prepared for the forces that it's going to encounter. And the best way to do that is really think about how we can actually ask the hips and ask the thoracic spine, that mid part of your back, for assistance. Because the lower back kind of gets a tug of war between those two areas. And if you can get those areas prepared for the movement and the encountering, the walking that you do throughout the day, it's going to be much more easy with the force distribution, and you won't feel so much pressure in those areas that you generally get sore. So first thing you got to learn is to make sure that when we do any of these exercises today, is that you don't want to push into any painful areas. You don't want to go into anything that's sharp. You don't want to feel pressure in the joints in your lower back. You actually want to feel more muscular tension. And then think through that as you do things just slowly, kind of waking up because you've been laying flat throughout the night. And the forces in our back are going to be highest in the morning and the evenings when our fluid levels are at their highest points as well. So I'm going to ask my coworker, this friend here, Paul, to come over, and he's going to demonstrate some of these exercises for you. What I'll have him do is lay down, act like he's just waking up from the morning here. Had wonderful dreams all night, I'm sure. Now he's going to be thinking about his back when he first wakes up because he knows the pressures in the back and those fluid levels are at their highest point. So the first thing he's going to do is just trying to gently kind of bend his knees up and bring them up towards his chest. Good. And he's going to kind of hug those knees. He's going to try to wring them out. Now, if you have any pressure that goes or pain that shoots down into your legs or anything that would be more considered disc affiliated, that would put pressure on that spinal cord at this point, you don't want to actually enhance that. You want to stay away from this flexed position. But if this feels like a good stretch to your muscles across your lower back, then you want to go ahead and encourage yourself to just kind of bring those knees up to the chest. You can make it a little bit more dynamic by kind of changing that position and moving it towards your right shoulder, towards your left shoulder. Kind of go with whatever feels good. And the goal here is to spend about 30 seconds in that position. Once you've done that for about 30 seconds, we're going to begin to introduce the idea of working in 3 dimensions. So he's going to then take those knees, bring them up to his chest again, squeeze nice and tight, and then he's going to roll side to side, just gently rocking from his right side to his left side. And at this point in time, he's trying to encourage that back just to gently kind of wake up and loosen up the muscles in his hips. Just trying not to fall off the bed, that's key. And now as he moves into and out of those positions, he's again paying attention. Does one side feel a little bit more stiff and feel like it needs to have a little extra motion in that way? Or do they both feel about equal? And that's okay, because we want to try to encourage him just to kind of go into the areas that feel good and then stay away from those areas if they're causing any type of sharp pain. The next thing you're going to do is he's going to just go ahead and let those legs kind of bring back down to kind of a hook-lying position here with his feet resting on the bed. And then he's going to gently take one of his knees, we'll use his left side, and he's going to bring it up towards that opposite shoulder. And what he's trying to do here is stretch out that glute, and he's trying to wake that guy up. A big rotator in the hip that you're going to need for pushing through those as you're walking and pushing through that stride throughout the day, or bending and squatting. So he's just waking that up, and he's holding this for a good 20, 30 seconds. So we'll pretend he's done that, and then he would switch up to his other side. Bringing that, perfect. So he's taking his right knee up to his opposite shoulder. You can take this in the straight position, or you can actually, our bent knee position, or you can straighten out that leg, trying to keep the toes pointed up towards the ceiling to get a better stretch in that right hip. Okay. Now he's going to bend that knee back up, and why don't we go into what's considered to be a figure 4. So he's going to stretch the other rotator in the hip that is very kind of overlies that sciatic nerve. So this rotator, it's very important to make sure that you're allowing yourself to gently get into this stretch. Again, it's been laying and not been used throughout the night mostly, so he's going to try to wake his body up and get that fluid levels increased in that area, cause the blood flow to kind of come back, and then he'll switch up sides and do the same thing on the other side. Good job. If you feel any pinching in your hip or anything in the joint itself, you want to back away from the stretch and not push too hard, because that's not a stretch, a gentle muscle stretch. That's what we're going for here. And again, 20 to 30 seconds, kind of working in and out of each position. All right, from there, he can let his foot rest back down on the ground. And then at this point, he's going to work on one of the big decompressors in his back known as a pelvic tilt. A lot of people hear about these or talk about these when you have lower back pain because you have that big arch in your back, that lordotic curve in your lumbar spine. What he's going to do is he's going to start off just kind of gently rolling that pelvis back, and I'll kind of just show you with my hands that's actually kind of rolling back towards and flattening out that curve in the spine. And this is a good way to kind of begin to think about getting that flushing to the discs. Good. So he's kind of wringing out that fluid that might be sitting there from all night. And he can progress this into what's considered to be a bridge, where he actually tucks, pushes down through his heels, and elevates those hips up off the bed, and then lowering back down. You can do 5, 10 of these, whatever really feels good. And again, you can think about maybe moving and shifting the hips to the right, to the left as you get up into that position to allow yourself to kind of work in that frontal plane or just different directions that will kind of allow those muscles to be prepared for what's more realistic in function. Then from there, he's going to show you guys a good way to get up from the bed so you don't just try to sit up abruptly and use those abs or those hip flexors that might pull on that lumbar spine. So he's just going to roll over to his left side there, and we'll pretend his legs fell off the bed. And then he'll push himself up into an upright position. And then from there, we're actually going to be standing up and showing you the next part of the exercise. So as he stands up, you can just face this way for everybody. Good. This is going to be more of a hip excursion. So what he's going to be working on trying to do is do those same kind of tilting to his pelvis. We know the pelvis moves in all 3 dimensions. So what he'll start with is just this forward bending, a little bit of a mini squat, coming back and kind of tucking the pelvis, drawing in that belly button. So let's do a couple of those for him. Good. Drawing back. Good. And as you get more comfortable doing these, you can obviously push the ranges of motion higher and higher. Just getting what feels good for your body. And then he's going to kind of stay in that position where he's kind of tucked it, not too aggressive. You don't want to be over clenching those glutes. And at that point in time, he's going to start to just rock side to side in that frontal plane. Good. So we'll show you a quick frontal angle of this so you can get an idea. His hips are just going to be shifting from the left to the right. Good. And again, he's trying to monitor his lower back and make sure that if at any time he feels like one direction pinches or causes any sharp pain, he'll stay away from that. And then let's go and show them the rotational direction. So then from there, he's going to stand and he's just going to turn his shoulders right, turn his shoulders left. And again, ask those hips and ask that thoracic spine for a little assistance in getting ready for the pressures the lower back is going to face throughout the day. All right. So now we're going to get ready for walking. And the next step, the final step of the series, is just going to stepping kind of in a stride stance like he just took a step. Good. And he's going to go through those same pelvic tilts, going forward, going backward, forward, backward. And then he's going to go side to side. Excellent. And then rotation towards the left, rotation towards the right. Very good. And then we'll try the other side as well. Right foot. And you can choose how many you want to do. Typically 5 to 10. But again, this whole series should take you roughly 3 to 5 minutes. Nothing crazy long. But again, it's going to get you a little more prepared for the day and not allow you to overuse that lower back. So this should help you wake up a little bit fresher and allow those first couple steps to be much more enjoyable and not necessarily straining to that lumbar spine. Because remember, in the beginning of the day, thanks Paul, the big things that you need to watch for are those big forward bends, picking up stuff off the floor. It could be as small as a tissue and as light as a tissue, but the idea is when the fluid levels are that high, you actually stand risk to actually injure those discs and those things in your back that are not quite ready and prepared through the weight bearing. So this is a great little thing to do when you wake up and just get yourself loose for the morning. Thanks. Have a good day.